Further amendments to the pending amendment in the nature of a substitute?
Mr. Chairman.
Mr. Deal.
Mr. Chairman, I have an amendment, the Ryan White Care Act. I think it's number 151.
Mr. Chairman, I reserve a point of order.
We could extrapolate how much. It's only $20 million.
It's
Yeah,
Deal
Mr. Scalise, you had reserved a point of order on the last one, but you withdrew it, right?
On our team.
I assumed if a point of order is not asserted before the vote, the chair will assume that the point of order is withdrawn.
It's 002.
It's okay. They're just logging in right now.
Amendment offered by Mr. Deal of Georgia at the end of Title V of Division C.
Without objection, the amendment is considered as read, and the gentleman from Georgia is recognized for 5 minutes.
I thank the Chairman. This amendment would reauthorize the Ryan White Act, the Ryan White program that is going to expire at the end of this September. I think most of the members of this committee are very well aware of the vital services that this funding program provides. I know that there may be a concern that this would be something that would be handled separately at a later time. I quite honestly, in light of the time constraints that we're facing, wondered why it was not included in the en bloc package that we considered earlier. I think it is of the same general nature, a program that has been in place for a number of years, one that almost all members of this committee agree with. I'm concerned that if we wait until a later time, that we will run into a situation where this committee does not exercise its jurisdiction to reauthorize this program, and we will see the Appropriations Committee usurp the jurisdiction over this issue from us and deal with it as an appropriations matter rather than appropriately as a substantive legislative matter within the jurisdiction of this committee. I think the amendment is very forthright. I think it addresses the concerns that many have had in the past, and I would urge its adoption.
Gentlemen, yield to me.
I will.
Thank you very much. I appreciate your interest in seeking to extend the Ryan White HIV/AIDS program for the next 3 years, and I'm also committed to addressing this issue. But we've heard from the HIV/AIDS community, and they've given us a proposal for extending the program. We have not had a hearing on their ideas, and I think they deserve to be heard. I'm not sure that I agree with all the proposed changes that have been recommended to us. This is a major reauthorization. For example, the amendment does not continue the protection for states with maturing HIV case data, which would greatly impact such states as Georgia and California. The CDC has stated that this data will not be mature until 2012. Thus, those states that transition to name-based HIV surveillance are currently undercounting their HIV data, which skews operation of the HIV-based Part A and B formulas. Before we act, I think we need to fully understand what changes we should make to the program as we extend it. So I appreciate your interest in the matter, but I would not be willing to support this amendment at this time. We will take up the HIV/AIDS Ryan White program and have some further hearings on it. I don't think we have to act now. It doesn't have to be within this bill, and I think it's involves a lot of issues that we need to look at a little bit more closely.
We're reclaiming my time.
Yes.
I understand that the gentleman's concerns about the way that we calculate the distribution of revenue. And that is one of the things that has been before this committee in the past, and we have grandfathered in states such as California, where I believe you still continue to use the number count rather than a name identification. And in previous hearings before this committee, it has been shown that parts of the country, the West, the Midwest, and the South, are generally coming up short on revenue because other parts of the country are using a number system counting people who are already deceased. And the purpose of grandfathering these states that are using that system in, and I believe it was a 3-year grandfathering period, was to allow them to make that transition. The longer we postpone that, the more we continue a discrepancy that exists in the law in terms of accurately distributing the revenue all across the country. This amendment would deal with that issue. It would not allow states to use the names of people who are no longer receiving services but continue to get funding as if they were still receiving those services. And understand the chairman's concerns, but I think it's time for us to address that issue. I would yield back.
Would the gentleman yield?
Gentleman yield to me?
Yes, I will.
Well, you raise a good point of why we need to deal with this legislation. It is expiring in September of this year. We will do a reauthorization, but I think we ought to, in my view, do it in a more thoughtful way, rather than just simply extending the law for the next 3 years. And you've raised some good issues that we need to look at carefully.
I yield back.
Mr. Chairman, I'll withdraw my reservation.
Mr. Chairman,
Who seeks recognition?
over here, Mr. Chairman.
Yes. Gentleman from Illinois.
Thank you, Mr. Chairman. I just find it very difficult to make the case that we have legislative language here and we're unwilling to move on a timely manner on health care because we haven't had a hearing. You've got to be kidding, Mr. Chairman. We passed a cap and trade bill with billions of dollars of allocation, agreeing to have a hearing after the fact on how the allocations would be, used in the bill that we passed in law. And now we're saying that Mr. Deal has a pressing concern that needs to be reauthorized, and because we haven't had a hearing on this bill, when we had a hearing on a draft bill, a tri-committee bill. Our hearing was on the draft bill. Then we had a dropped bill, and then we had the CBO score the tri-committee bill, and we had a closed hearing on the CBO scoring, and then we had a manager's amendment of 300 pages, and you're going to make the argument that in this case we have to go through regular order? I'm just astounded, and I'm sorry that that's your line of logic in disagreeing with my colleague's amendment, and I hope calls for a vote, and I will support it.
Would the gentleman yield?
I would yield.
So I don't have to get my own time. I want to support the Deal amendment, and for one primary reason. First of all, the Ryan White Reform Act that we passed several years ago was done on a bipartisan basis. There were several compromises that were carefully worked out in the stakeholder community and across lines, both here in the House and the other body. I was very proud that that passed under my chairmanship. I take Chairman Waxman at his word that he wants to reauthorize the Ryan White Act sometime this year, but the problem is that it expires in September. We're in the middle of July. We're going to be out of here in the next 2 weeks. There is no time to have a hearing, to have a markup on a standalone bill. And when we get back in September, we're going to be involved in the appropriation process. And if and I say if, the climate change bill goes to conference with the Senate, and if we get this health care bill out of the House and the Senate does, and we go to, with all due respect, Mr. Chairman, even with the best of intentions, it's very unlikely you're going to have time to give the HIV/AIDS community the standalone time that it needs. I would suggest that we should pass this reauthorization amendment into this act, do all the due diligence that you've talked about. We can work out whatever compromises need to be worked out and include them in some sort of a bipartisan manager's agreement if and when the health care bill goes to the floor or in conference with the Senate. But at least according to the Speaker of the House and the President of the United States, this major health care initiative is a must-pass, must-do piece of legislation, and that means we should put things like this in it. And in this case, I don't think that this is really that controversial. There may be some community concerns about revenue sharing and amongst cities with growing AIDS, HIV populations and communities that have historically had high concentrations but are declining. So there may be some of that need to be worked out. But the basic reauthorization should be pretty straightforward. I don't know why we can't accept this. So I hope that we do accept it. And I yield back to...
Reclaiming my time, I want to talk process again. We accepted cash for clunkers in the energy bill without a single hearing, a major policy provision. And then that bill was pulled out of the passed bill and thrown on the floor without any hearing or committee process. So y'all can do pretty much what you please. And I would suggest that this bill and this reauthorization, we ought to include this. And I, again, will support my colleague's amendment.
Mr. Chairman.
The gentleman's time has expired. The chair
Chairman.
recognizes himself. I was the original author of the Ryan White Act in 1980s, 1990s. No, it was 1990. It was passed on a bipartisan vote. In every reauthorization in this committee, it was passed on a bipartisan vote. And I don't think we ought to have the Republicans trying to use this now for a partisan issue to say we got to do this now.
Mr. Chairman, I object to that. We're not being partisan about this at all.
Well, then let me...
You're the one who's scheduling the markup. You're the chairman.
Well, let me reclaim my time by saying we've got some issues to deal with in this bill. And if we simply adopt this legislation in this broader bill and reauthorize the Ryan White Act, we will not have addressed some of the concerns that many members have, including the Speaker of the House, who's communicated to me her concern about reauthorizing it without changes. We need to revisit some of the terms of this legislation. Now, I think it's appropriate to do that in the context of hearing from those who have concerns about it, not simply extending the reauthorization for an additional 3 years. I know that the gentleman from Illinois wants to pound the table on the process. I used to have a good friend said if you have the facts, you pound the facts. If you have the law, you pound the law. And if you don't have either, you just pound the table.
Will the gentleman yield?
No, but the facts of the matter are that while I will acknowledge that some of the complaints that people have are legitimate, we had hearings on the health care bill. The tri-committees...
Gentleman yield.
Oh, please. We had hearings on the draft proposal. We had extensive hearings on the energy bill. We even had hearings on the last part of the energy bill with allocations, although it was after the fact. We could hold hearing after hearing, and that's more than what we had on many of the items that we had before us when the Republicans were in control. Anybody want to say no real loud?
Will the gentleman yield?
I will in a minute.
I'll be happy to comment on that.
I probably shouldn't even go down that road because you're going to go down that road, we're going to go down that road. You did it, we did it. This amendment is to reauthorize the Ryan White Act. It's a major reauthorization. We should do it this year in this committee, working together. In terms of the expiration, it's the expiration of the authorization. The Appropriations Committee often moves forward with appropriations, notwithstanding reauthorization not having been passed. We will be able to get to that reauthorization as soon as possible, certainly within this year. So I would urge members to not rush this thing through without getting full impact from the different stakeholders and not just keep the status quo.
Would the
Mr.
chairman
Engel, yield to you?
Yes, thank you, Mr. Chairman. New York still remains the epicenter of HIV/AIDS. So the Ryan White Act is very important to me. It's been one of the things that I have been working on for many, many years. And Mr. Chairman, I want to share your concerns with just reauthorizing the program such as this. I speak with the HIV/AIDS community all the time. They have many different proposals for changing the program and extending the program. And I think that we ought to listen to them, and I think it deserves to be passed, as you said, Mr. Chairman, in a bipartisan fashion with give and take, and having the HIV/AIDS community a very, very important part of the process. And I think that if we simply just reauthorize it in this bill, we will have made a mistake, because we'll have lost a lot of the input of the people who this affects the most. So I agree with you, Mr. Chairman. I think that we should not do this now. We have a very limited time, obviously, because it has to be reauthorized within the next few months. But we should make sure we give it the attention it deserves as its own stand-up bill, as you said, with the give and take of bipartisanship. We did it with Chairman Barton before, and we tried to do it in a bipartisan manner. And I'm sure we will do this reauthorization in a standalone bill in a bipartisan manner as well. As you point out, there are many concerns that many of us have, the Speaker and you and I and others. We would like to see some changes into the reauthorization, and to simply extend it now would be to run roughshod over those changes, and I think it would be inappropriate. So I yield back, but I think
Thank
you're
you, Mr.
right on
Engel,
the money with this.
And I yield back the balance of my time. Further recognition, Mr. Barton.
I haven't spoken on my own time, Mr. Chairman, so I'm going to speak in favor of the amendment. And I want to educate the more junior members of the committees on some of the things that Chairman Waxman just said. It is true this year that he and the subcommittee chairman on the majority side have held a number of hearings on these big issues. They held hearings on the general issue. Now, there used to be a tradition in this committee that you would put out drafts, you would circulate the drafts, you would modify the drafts, and finally, when you thought you had consensus amongst what should be in the bill, or the majority decided that a consensus was not possible, then you would circulate the bill that was actually going to be marked up, and then you would hold a hearing or legislative hearings at subcommittee and sometimes at full committee on what you intended to mark up. A legislative hearing. Now, we had one so-called day of legislative hearings on this bill where the Secretary of HHS came forward and testified that she really hadn't seen the bill because the bill hadn't really been put together. And then we had a closed briefing, not a hearing, where CBO came forward and commented without the public or out the press that they really hadn't been able to score the bill. They were scoring a verbal explanation of the majority staff's explanation of what was in the bill. That is not regular process. That is not a legislative hearing. That is, in my opinion, a diminution of the process. Now, the reason the Ryan White Reauthorization Act is expiring in September is because when I was chairman and we reauthorized it, we wanted it to come up in a timely fashion, not 5 or 10 years down the road, because at least then, and I'm assuming that's still the reason that there's stakeholder concern, you have communities in the country where the AIDS, HIV population is growing, and then you have communities where historically they've had concentrations, but those areas are either declining in the intensity of the epidemic, or they're not as relevant, and there is a formula where you take total cases into consideration, but also existing patients who have the condition, and that's an ongoing debate. Now, had the majority been totally sincere about reauthorizing this, they would have been holding hearings at the subcommittee level and perhaps at the full committee level to bring the stakeholder community. There's not been one hearing on the Ryan White Reauthorization Act scheduled, Mr. Pallone's subcommittee or the full committee. There hasn't been a general hearing. It hadn't even been noticed. Now, we have an arbitrary timetable by the Speaker of the House and the President that this health care bill has got to move out of the House before the August recess. That's not a a bill that's expiring like the Ryan-Whites Act. That's not a statute in law. That's some sort of a internal policy decision between the president and the majority in the House that this bill has to, the bigger bill has to move. Why wouldn't we put this on it? Chairman Waxman's not going to schedule a hearing on the Ryan-White Act next week. He's not going to have Subcommittee Chairman Pallone move an authorization bill through subcommittee next week. Why do we not put this in the bill that's got to move? And then, as we go through the process, if the process goes forward, then we can make some of these changes that Congressman Engel and Chairman Waxman are talking about. I mean, this isn't partisan. This is the train that you guys say is leaving the station. Let's put the stuff in it that we have bipartisan support. Let's do it. Now, I don't, call me crazy, but I don't see why that becomes a partisan issue. So I hope we put it in the bill, and then we do all the things. If Chairman Waxman wants to move a standalone bill next spring or later in the fall, we'll be very supportive of that. But this is the train, according to your own train master, that is leaving the station. So we ought to put this on the train. I yield back.
Mr. Chairman.
Gentleman yields back. Mr. Pallone. Gentleman's recognized for 5 minutes.
And I'd like to yield to you some time.
Well, I thank you for yielding. I want to correct the record on a number of issues. We had a draft of this health care bill out, and then we had 4 weeks of hearing on the draft of the health care bill. Now, let's contrast that with the rosy picture that we've had that the Republicans never did anything out of the ordinary. They always followed regular order, had hearings, legislative hearings, oversight hearings, full opportunity for the process. Well, for the Medicare Prescription Drug and Modernization Act in 2003, in the 108th Congress, we considered that bill, which provided a new expensive prescription drug coverage under Medicare. Despite the sweeping policy and cost consequence of this measure, the committee held no public hearings on the legislation. There was no subcommittee markup. Democrats did not receive a copy of the legislation until late Friday afternoon before a Tuesday markup. In the 109th Congress, the committee considered H.R. 3893, which codified controversial Clean Air Act new source review regulations of the Bush administration and provided for the expenditure of hundreds of millions of dollars for programs relating to supply and use of petroleum and other energy products. The committee held no legislative hearings on the legislation, no subcommittee markup. Instead, the bill was released on a Friday night at 10 p.m., allowing only 2 business days for its evaluation before a full committee markup the following Wednesday. There was another bill that I took special umbrage to called the National Uniformity for Food Act of 2005. It was in the 109th Congress. Mr. Barton was chairman. The committee considered the bill, which would have preempted virtually every state and local law that protected consumers from contaminated food. It would overturn a long-standing law in California. The committee held no hearings on the legislation and no subcommittee markup. In the 109th Congress, the House considered H.R. 5254, a bill that directed the President to designate no less than 3 closed military installations as suitable for refinery construction and required states to meet a federal schedule for issuing refinery construction permits. This was put on the House suspension calendar, normally a procedure reserved for non-controversial bills. It was brought to the House floor just 1 day after it was introduced without the benefit of any legislative hearings or markup by the committee. The Energy Policy Act of 2002, Representative Barton introduced H.R. 3406. It made controversial changes to federal laws governing the electricity sector. This bill was never marked up or reported out of subcommittee or the full committee due to its lack of support among committee members, and the provisions were not included in the broad energy policy bill H.R. 4 that was considered by the House. Nevertheless, when H.R. 4 went to conference, then Committee Chairman Tozan and Representative Barton announced that the House would take H.R. 3406 into the conference as the House position. These are a few of the examples of how Republicans handle this regular order when they control this committee. Now, as I said earlier, I don't like that you did this, we did that, you did worse, we did better, worse, and we did better, and so on and so forth. I just think on this amendment that's before us, we ought not to put it in this bill. We ought to hear from the stakeholders. We ought to have a reauthorization. There's nothing that's going to happen in September other than the Appropriations Committee considering the appropriations and going forward, and we'll get a reauthorization in due time. But let's do it together on a bipartisan basis, and I would urge members to oppose the Deal amendment. I yield back the balance of my time.
Move to strike the last word.
Gentleman from Oregon is recognized.
Thank you, Mr. Chairman. I guess my frustration today, and I intend to support the gentleman's amendment, really gets back to this notion of did we have a hearing on this bill? And the state I came from, or come from, live in, when I was in the legislature, we had rules that required hearings before bills could be marked up. And I realize we don't operate that way here. Both parties have had, as we know, their problems. But on a bill of this significance, where we're going to have a complete government takeover of health care, a complete rewrite of everything else that's left, a public option, new taxes, everything else, you'd think we'd at least allow the people to come in who are affected by the extraordinary changes in this bill and have a chance to let us know how it affects them. I read in the New York Times that the governors, Republican and Democrat, gathered in Mississippi this weekend, and Republican and Democrat governors from Vermont to Mississippi raised very serious concerns, for example, about the Medicaid portions of this bill and the potential costs, unfunded federal liabilities that may go to the states. It would be nice to hear from the governors to get their ideas about how this bill operates. When Secretary Sebelius was here, I attended and participated in that hearing, but was told pretty clearly by the subcommittee chairman, as I began to ask Secretary Sebelius specific issues related to the bill text itself, that it wasn't appropriate to ask the Secretary of Health and Human Services specific questions about the bill because she wasn't necessarily here to testify on the specifics of the bill and didn't fully have it in her scope. And actually was told, don't be asking the Secretary questions about the draft. So I don't know who we were supposed to ask, if not the President's top person on health care, other than the czar, about the impact of this bill. So it just seemed peculiar to me to hear that we couldn't reauthorize the Ryan White program because we hadn't had a hearing on this amendment.
Gentleman, yield to me.
When, in effect, we've had no meaningful hearing from, I'm not on the subcommittee, but on the full committee, yes.
Gentlemen, well, you're not on the subcommittee, but had you been on the subcommittee, they had over 50 witnesses testify before the Health Subcommittee on this very bill. The hearing that you attended was in the full committee because we had the secretary, cabinet secretary. But we had a week of hearings on the bill. The bill's been out for over 4 weeks.
Mr. Chairman, reclaiming, my understanding is that was the draft bill, not the bill we have before us.
It was the draft of this. It was the first draft of this bill.
The first draft, but it had not been introduced.
It had not been introduced as a bill, but it had been put out as a draft.
And it changed after that to be the bill that's before us. In fact, 8 pages were added after the bill that came to us
I think that was about 500 pages ago.
What was the length of that draft bill?
It was around 700, 600 to 700.
Gentlemen, yield.
Yes.
It's not a question of the length. The draft bill set out the basic framework for this legislation.
Reclaiming my time, Mr. Chairman, if I might, it's about a 300-page difference or more between the draft. And I realize the draft represented principles, but I also know that there's a huge difference in one word, shall, may. There are huge differences in every word in every bill, or can be. All I'm saying is that it seemed a little peculiar to hear the argument that we couldn't reauthorize an existing program because it hadn't had a hearing. I actually favor hearings But we could move forward on this bill that my own personal view is it hasn't had adequate hearing to really get into the weeds on what it does and how states will be affected.
Gentlemen, yield to me further.
There's a lot of concern in my state about Medicare and Medicare rates and what may happen to them if this bill becomes law, because Oregon is very efficient in its delivery of care and very low in its cost of that delivery. So any cuts across the board on Medicare have a significant and adverse effect in terms of access to care for Medicare recipients and whether providers can continue to go forward. There are lots of issues in here that affect us, and certainly, Mr. Chairman, my friend.
Thank you for yielding. I want to point out that the draft bill, for which the subcommittee held a week of hearings, was basically the bill before us. The biggest change in that bill that you've talked about that was changed was the part coming out of the Ways and Means Committee of the pay-fors. That is extensively spelled out. It's not the jurisdiction of this committee. I appreciate what you're saying. I think we ought to have, we're going to continue our oversight, our markup on this bill, and I just think on the Ryan White Act, we ought to hear from witnesses and proceed in a more orderly way.
Mr. Chairman. Mr. Chairman.
Who seeks? Ms. Schakowsky.
Yes, I move to strike the requisite number of words.
Generally, recognized for 5 minutes.
On the issue of the Ryan White Care Act, I just want to say that I appreciate Mr. Deals and Mr. Barton's support for the act and their concern for reauthorizing it before it expires. I think that in general, the conversation about Ryan White is a good one. But I want to say that I've also heard from the AIDS Foundation of Chicago. I don't know if Mr. Shimkus is still here. Are you here? Okay, there you are. And while major changes in the act they don't think are necessary, there are some adjustments that they think should be made. In fact, if they're not made, we stand to lose money in Illinois. And they, along with 250 AIDS organizations around the country, want us to look at the issue of the use of code-based data. And while they're committed to moving to HIV name-based surveillance data sets, they want to make sure that they're complete and accurate before formula funding awards are based solely on those data. And they also suggested a number of other things, expanding the coverage of food pursuant to a doctor's or dietitian's prescription as a core medical service, and reviewing the regulation that restricts access to medical transportation, particularly in large rural areas and areas without a strong public transportation infrastructure. So there's a number of ways that aren't huge but are significant that deserve that kind of discussion, and hopefully those of us, it seems like all of us or most of us, who support Ryan White would support those kinds of changes. So I'm hoping that we can work together on a timetable that Mr. Waxman has committed to, that we're going to do it before September 30th for a reauthorization that's even better than the bill that we have now. So I would support not doing it in this bill right this minute, but to later on develop an even better Ryan White Care Act. And I yield back. I yield to my colleague from the Virgin Islands.
Thank you. I also want to say that I appreciate the ranking member and Mr. Deal's interest in reauthorizing Ryan White, and I look forward to working with them and you, Mr. Chairman, as we approach September to reauthorize it with the input of the AIDS community. I have a very good relationship with many of the AIDS advocacy groups, and they've asked us to include several issues that cannot be addressed if we rush to reauthorize it now, as well as the Department of Health and Human Services, and the administration also has some issues that they want to weigh in on. So I look forward to continuing to hear from these groups, to incorporate the issues that they feel are important, to looking at the distribution of the funding, because even when we reauthorized it for the 3 years, we did it for 3 years because we weren't able to address many of the issues that were really pressing, and so we did it for a shorter period of time. So I oppose the amendment and look forward to reauthorizing it with the input of all of the different groups in the administration.
Reclaiming my time, I'd like to yield to the gentleman from Texas, Mr. Green.
Mr. Chairman, members, and Mr. Deal, I remember the discussion we had when we reauthorized this a few years ago, and when our ranking member was chair, and I know there will be discussion on formula battles between Georgia and Texas and California and New York, and I agree. I wish I could tell you I was prepared tonight to do that, because we did have a funding formula that at that time was fair. I don't know what I could support tonight, though, that would be fair to the state of Texas any more than I could say it to my colleague next to me, the state of New York. So I have no problem putting off, because I want to have that battle when we get it in there. And I remember the battle we had was between California, New York, and other states that had a growing population of HIV that we could not get the recognition that we needed through Ryan White. And so I want to help you, but I don't know if tonight's the best night. And I thank my colleague from Illinois for allowing me a few seconds to say that.
Yield back the balance of my time.
Gentlelady yields back the balance of her time. Are we ready for the vote?
Mr. Chairman, I have a unanimous consent request.
Yes, Mr. Deal.
I would make a unanimous consent that instead of the 3 years shown on the face of the amendment, that it be a one-year reauthorization, since that way this committee would have acted to extend the legislation and will not be subject to the Appropriations Committee being the one who makes a decision about this very important piece of legislation. And I would ask unanimous consent to change the effective date for a one-year reauthorization.
So reserving the right to object. The reality is if the reauthorization is not in effect, the Appropriations Committee will still consider appropriations. So we don't have a drop-dead date on the reauthorization. And there are strong feelings about some changes that need to be made even for that one-year period. I'd like to talk to some of the groups involved. Have you talked to some of the groups? Evidently, our staff has talked to some of the groups, and they would just feel that they didn't get their chance for input, even on a one-year reauthorization. So, given that fact, I'm going to object to it, and suggest to the gentleman that maybe we can pull this off and discuss, because this is your subcommittee with Mr. Pallone, figuring out how to do a reauthorization in a timely enough fashion.
Mr. Chairman, I just don't see any time between now and the time that this act's going to expire to have the hearings and do what would normally be done to deal with a full-blown reauthorization. I assume that yours is an objection to the UC request.
Well, let me suggest this. How about withdrawing your amendment now with no prejudice to you coming back before we complete the markup on this legislation and see if we can figure out something to do together.
With the chairman's assurance that we can rebring it, I'd be glad to withdraw and I will withdraw the amendment.
Okay, thank you. The amendment is withdrawn.